So we're going to try and keep it in the middle ground. So there'll probably be pieces where our colleagues as medical doctors will understand a little bit more, and then we would also really like our audience that's layman in the medical field to understand. So maybe just for the people out there, just give a brief anatomy of the hip, how the hip fits together. I know it's a ball and socket joint, so maybe just so people understand where it sits in the body and why it's so important.
Yeah, so from my side, I think it's the center of the body. You need the hip for everything. And the hip really affects you if you're really in pain there. So it's a ball and socket joint. You have on both sides. The human person is the only one, and the specific muscle around it. We learn a lot more about this, specifically for upright stance. So small things which people don't know is that the human person is the only one who's got an iliotibial band. No other animal has that, and it's quite an important structure. And that's what and the iliotibial band is kinetic type of chain, so it's like a elastic, and that's where the mobility is very important. You actually need weaker muscles as long as the kinetic chain is well nutritioned. Anyway, the hip itself actually has interesting stuff around it. We know different things about the shape of the hip these days, and that can preempt you arthritis in the hip as well. So if you can address these things and pick it up early, you can address that. The hip labrum is a big thing. I get a lot of referrals to see the labrum or see labrum tears, and we fix that these days with arthroscopic surgery.
So I think that's quite interesting. So I think so we've got the hip, we know where it is. It's a ball and socket joint. The femur sticks inside, and that's where we actually carry our weight through onto the pelvis. Maybe let's try and speak about, because I mean, hip replacements is actually the surgery of the previous century. It was said that that's actually the operation of the previous, and maybe we should talk about that, because I mean, such a big part of how you got to what you're doing is hip replacement. And maybe let's pull back from hip replacement. So you get hip replacements because you fracture a hip. So maybe we should just talk about hips, the healthy hip. What things can you do to keep your hip healthy?
So just from there, just with the fractures and the non-fractures, is that we have to really look at this, because people associate hip osteoarthritis and osteoporosis. It gets confused always. So when you have weaker bones, you have osteoporosis, and it tends to sound the same. And osteoarthritis, so in the layman, you get confused. So osteoporosis will give you fractures. You normally can get a fracture in the wrist, in the spine, and in the hips. But in the hips, it's quite detrimental. It's very expensive for the medical system. And then the osteoarthritis is where we get wear and tear in the hip. And that's a different one. But both are treated with osteoarthritis at the end. So I think, so we talk about hip health, osteoporosis.
Yeah, but that is towards the older people from 65 plus that we see both of those conditions more often, or do you see some of that at the earlier stage as well?
Yeah, we do see it at earlier stage. It's more endocrinal problems, parathyroid, things like that, which affects your calcium absorption, surgeries which can cause that, so on. So it depends on, and then certain medications as well. If you're long-term on cortisone treatments for organ transplants, all these things, rheumatoid, those things, they can also get more osteoporosis as well. So yes, osteoporosis in essence is that you don't get enough, or your bone mass is actually less. So we look at it as a bank. So you can put things in your bank, but if you don't put things in your bank, you will have less of it. So it's important. Yes, the problem starts at a later age, but you can do a lot. You basically have your physical bone mass at the age of 35, and then it's actually starting to drop. But the most important thing is to build into that bank. And to build into that bank, you have to keep mobile, so weight-bearing exercises. Specific, actually, yeah. So it's interesting. A runner can also get osteoporosis because it's not just one sport. So the idea of multiple type of sports, not just a cyclist, it's been associated. You think, okay, it's just if you're cycling non-weight-bearing exercises, you can you will get more osteoporosis. it's been now shown not to be. Actually, there's a big study now in Australia which they've just showed that people are actually just taking more senior people and building their bone mass just by doing some kettlebell lifts. So that power is very important, and loading onto the hip. And the idea of actually explosive type of things like jumping can help, but then on the other side with fractures, the risk of fractures, you lessen there. So that's then the exercise part. Then you must look at your absorbing more calcium. So calcium into the body has to be converted via vitamin D3. Otherwise, it's not active. And that's the main thing here. So it's part of, you get vitamin D3. We don't get into the sun these days. If you go out in the sun and you put a factor 15 or anything higher on your skin, then that doesn't convert D to D3. I think you've recently also said you must sit a half an hour in the sun a day. But if you can't, like me, I'm in theaters, I pop my D3s, and that's very important. So then that's the nutrition part.
I can tell that most of the clients that we test is low in vitamin D. We need to supplement almost all our clients with vitamin D.
And then another thing is that the whole thing of the HRT, that whole myth that people which should not get HRT, the main thing with hip fractures is much more common in ladies because they go into menopause, and you don't have estrogen, and then you actually, that's not good for bone health. And then also the males later age, so fractures at the age of 85 is actually not great. So talking about these fractures, and that's why should I do all this, is if you get a hip fracture, your chance of mortality in the first 30 days, and that's after the age of 65, is 5 to 10%. And then if you have on the other side of and then in 90 days, that's also 5 to 10%. So in 10% chance that you'll die from a hip fracture within 90 days. And 20 to 30% that you will die from a hip fracture within a year. So the big thing here,
That's high aim.
that's very high. So it's like a myocardial infarction, and it's preventable. And the best preventable is mobility, active walking, be busy, and look at your diet.
Yeah. Yet again, you need to start early and build up and prevent things like that. It's a compounding interest type of theme. We need to do more when we're younger.